Hello. Yeah, we lost some folks. So we just wanted to kind of close the day and try to wrap everything that was said and sort of tie a nice bow on it. So I first wanted to thank everybody who spoke today, and thank you all for coming and sticking around to the end of the day as well. I also wanted to introduce Leanna Major with the Colorado Health Institute. Thanks for joining us this afternoon as well. So I wanted to sort of just start by asking each of you, based on your work and your perspectives and what you've been involved in, what does it take to move the needle toward in the direction of solutions in the work that you're doing? And what does that look like? And when I think about that, I think about policies, or what people can do, what companies can do, where money can flow. It's kind of an open-ended question, but just based on what you shared with the audience today, what does it take to move the needle?
So while I was listening to Claire's presentation today, I was thinking about this exact topic, and I wrote down 3 things, so I figured I'd look at them while I was talking. One is that I think in some ways innovation is just convincing people and trumpeting out that common sense is appropriate. And so, for example, I'll just cite Jayla Sanchez Warren today saying, food. If you're discharging people and they're not going to have food for a few days, get them food. And so this is not about technology or the future or robots or AI. This is just people, we need a little common sense. And there are places where it's not fancy innovation, it's just old-fashioned work out your workflow so that you can get people food. So that's one side of it. And then the other side of it is that there are places where there isn't going to be an evidence-based program to say something works, but that technology is going to be the only way you scale it, and you should just try it and move it instead of testing the hell out of it. Excuse my German there. And I think that there are 2 edges. These are 2 sides of innovation that common sense, if we could just use and fund properly, would actually move a lot of things forward. The middle of it is that people are always there, and that there is always a personal impact of care. We call it health care, not health science, because there's a care aspect. And I believe that every system you need to design technology plus people systems and work through the workflow. And so I think that there's really, it's these 3 things. Common sense on 2 sides, and then the complicated case of designing how tech fits in and making sure that people get paid to change. Okay, that's complicated, but there you go.
I think every single one of my kind of implication slides that I had in my presentation had forging partnerships, and I think that is going to be how it works in the future. I don't think that health plans can do this alone. I don't think that community-based organizations can do this alone. I don't think that state or local governments can do this alone either. So I think I have been following what SAPCA does, and I think they're already starting this conversation, talking about all of the parts of the government that touch on aging in the older adult community. That is what we need to see more of in healthcare, and I think that's really where we're coming from when we think about this future of health conversation, is trying to get healthcare companies to recognize that they will not and cannot do this alone. So really, the forging partnerships, I think, would be what I would say.
Does this one work too? Thought yours might be. Yeah, yours prettier. To move the needle, I think we need radical old people. Yep. I mean, that's what it would change everything. I really, really believe that. I wouldn't say it. So 6 or 7 years ago, a number of leading aging organizations, including AARP, but it wasn't only AARP, commissioned a study by an organization in DC called the Frameworks Institute. And they put together a report called Gauging Aging. And the way that they do their social science research is they interview the public about their concepts and perceptions of aging, and then they interview experts in aging, and then they try to figure out how to explain the gulf. And in the report, one of the things that was most striking for all of us is that people face aging by themselves, that it's a one-by-one, singular experience. And what we don't have in aging is a collective sense of outrage or voice. And that's the biggest difference, one of the biggest differences between aging and disability. The disability advocates will not stand for policies to be developed without their input. And to really move this needle on any aging program, the voice of older people themselves, speaking on behalf of age, will make the fastest change. And it's hard. I mentioned earlier that we don't have oral health benefits in Medicare. Imagine if every older person who struggled with lack of dentures or payment or oral health, if every one of those older people went to the town hall meeting of their congressperson in every August forever and got really loud. We need this because it's never going to work in Washington. Someone like me is never going to be successful unless people who are experiencing the problem at home talk about it with policymakers. I can't be the one to reveal the problem. I can be the one to help work on solution. And and I took a lot of women's studies courses. We talked about the personal is political. And that's what that means. If it's happening to you, it's happening to everyone else. Think what we could do for family caregivers if they were moving as a block as family caregivers. We would not be so far behind on leave policies. So somehow a collective sense of us and we and lack of third-party kind of thinking about aging. But I've ended more than one talk saying, well, we just need to march on City Hall. I really do believe that that would help.
Well, I think what would help move the needle has been a common theme throughout what all of us have spoken about, and Haley mentioned it as well, and that is going around talking, forging partnerships, developing protocol systems and care delivery that encompasses the whole person, the holistic, the food insecurity, the housing needs, not just what's traditionally been considered health care, but incorporating those social risk factors of food insecurity, not having enough healthy food accessible, addressing food deserts, as well as affordable housing. Those are going to be critical, and more outside of the healthcare sector as well are realizing that and are looking to see what are some solutions, but we all need to come to the table and talk about it, forge partnerships. You as community health workers or community workers, community-based organizations can really partner with providers of healthcare to really impact health outcomes and collecting that data and showing it, and I think that would help move the needle.
If I could reduce my advice to a small, catchy poster, I would say stay calm and pick a place to start when it comes to housing. I've spent the last year talking to a lot of folks in the community, working on a whole range of issues, and I think the first thing out of their mouth is always, oh, I don't know anything about housing, so I can't be a part of this, or I don't have much to offer. And then 10 minutes later, they know so much. They just don't think that they know a lot. And what I would say is that you all are gap fillers. You are really important people who exist in this really important space between the medical community and then the housing expert community. You are people who know the aging community really well. You know your people really well. You know how to speak both languages. You just need to know how to speak enough of each language and advocate for the folks that you work with. And we need more people who are okay not knowing everything about housing, but who can speak up and fill that gap and help us bring the housing and health worlds a little bit closer together. And so I would say that there's a lot of low-hanging fruit, a lot of ways that we need to just maximize the dollars that are already out there. For instance, in the city of Boulder, we have protection for source of income discrimination. That's huge. That doesn't exist all over our state, but we need to expand that in other parts of our state. We need to make sure that our affordable housing funds that exist, that those are being maximized in an equitable way, that they're going to the people who make the lowest incomes, that need the most assistance with housing. So we need to speak up for those things. And then when we want to get creative and start working in other places, think about where your biggest opportunities are. Is it your faith-based communities? Is it trying to, maybe your hospital systems have housing development or have own property near the hospitals that they could lease to the housing authority and turn that into senior housing or lower income housing to serve folks in a way that makes it accessible to the medical community. So I think there are a lot of places to start, but my advice is just to don't underestimate yourself. You have a really important role to fill between the medical world and the super wonky housing world, and there's so many people in the middle, and that is you in this room.
Great. Thanks. I want to pick up on advocacy a little bit, and this came through a few times during the day too. I think specifically political advocacy. So what I was thinking about, and you were talking, Kathy, was the Grey Panthers and sort of the movement, the sort of the radical age movement. There's an actual radical age movement in New York City, actually, that does a lot of pretty awesome activism. What do you think it would take to really to activate older adults? And the flip side of that question, do you think that the incoming generation of older adults will be more politically active in advocating for their for respect and inclusion or their rights? And I see healthcare as being a potential mechanism for that advocacy. We're not seeing it yet for some reason, or at least at the national level, we're not seeing a whole lot of it, which is maybe somewhat surprising because it affects so many of us. So I'm curious about sort of the organic opportunities for there to be greater political advocacy at, let's say, at the national level. What institutions are there that could facilitate political advocacy for aging, services and programs across healthcare and the social sector, and maybe even into regulation? AARP is a sponsor of this event, and they do some advocacy, and I'd say even the Age-Friendly Communities movement is passive advocacy, passive political advocacy in a lot of ways, and in some cases it's turning into active political advocacy at the very local level. So I'm curious about that, from your perspective, what you see organically or institutionally, and similarly with, I'm curious about Medicaid too. With Medicaid policies, what are the opportunities from your perspectives at the national level for there to be more influence over state level Medicaid policies?
So what will it take to achieve overwhelming social change? In a nutshell. So I'm 59. So it has to start with me. So when someone says, what about older people? I'm going to say, well, those of us 59 turning 60 next year think this, that one place to start is simply to pay attention to who's giving voice to the issues and facilitate and support older people being the champions for aging, not those of us who are making our way in that direction. And it's as important as any other kind of social field. Like if you're working, I'm from the Midwest. We are like predominantly white culture in the Midwest. If you're talking about programs that impact people of color and the whole room is white, it's like really important to say, guess who's not in the room? That I can tell you what I think, but this is incomplete, uninformed work if it's not inclusive. And we have to start thinking about aging in that way. One of the last things I did when I was Secretary of Aging in Kansas is tell the Area Agency on Aging directors, it's like, you have got to start bringing older people to my budget hearing, because the legislature will treat this differently. If the first two rows are full of older people themselves, then they're looking at me, who is at that point 10 years younger than I am. So I think it's going to take some of those of us in the field, and it's going to take you all on the stage instead of me until I'm ready to be the same age. So I will do what I can for those of us on the younger end of the boomer generation, but those of us professionals in the field also fall prey to not really putting a different voice in the leadership and paying attention to when they're not leading.
Oh.
I just wanted to add before we moved on to the Medicaid point. I completely agree, and I also think that needs to be paired with some reality that faces many younger people today too. There are millions of people who live in intergenerational households, and there are many, many reasons why that's happening. Opioid epidemic is a huge part of that. There are many grandparents taking care of their grandchildren because of the opioid epidemic, and those grandchildren are starting to see how their grandparents and the older adults in their lives are treated, and it's I think also not lost on millennial caregivers, and that is a massive population of people as well. So I think we live in an age where OK Boomer shirts are apparently a thing. I just found out last night. I don't know if anybody else has heard of these. I know we live in a generation or a time where that is what you see on Facebook or in social media. And I think what unfortunately doesn't get as much clickbait or coverage is the fact that there are millions and millions of young people who do care deeply about how people are aging in this country. So I completely agree with that, and I also think it can be paired with, it's not one or the other. That was just a point I wanted to add.
I think you had another. Did you have that?
Oh, I was just going to.
Do you want to?
I was going to make a plug because I believe that the activism and getting your voice out is critical, and say, come to SAPCA meetings in Denver, come to our listening activities, and give everybody an earful. We do keep records of what's said, who says what, and there are a lot of things that happen on Capitol Hill. Please come speak out. If you know other people who have voices, it's critical to keep on doing this at scale. To your point, Claire, you've got folks who are working longer who actually cannot. You've got the working poor who are working and can't take care of themselves. But if you have a chance to lend your voice, please do repeatedly. That's a direct plea.
Did you have another question for Kathy, or you were Medicaid policy? Is that the question? What would it take to change Medicaid policy? Is that the question?
Maybe more the degree to which you see professionals and citizens and residents influencing and impacting Medicaid policies, and is that certain? Or do you see certain states? Do you see a relationship maybe between some forms of advocacy that are fueling more innovative or experimental states that are sort of broadening their approach or definitions?
Okay. Well, and I think Medicaid's this big ship that would take a very long time to turn around, right? Since 1965, it's been around, and it's been on this trajectory, and there has been some opportunities to change how Medicaid is delivered through the CMMI, the Centers for Medicaid and Medicare Innovations. And I think that the opportunity could exist and does for states to bring innovative ideas to CMMI or to Medicaid, because states really are the laboratory. They are the innovators. They know what's going on in their states and their populations. You know what's going on in Boulder County. You talk to the state. You have opportunities to talk to Haley and others at the Medicaid agency. You can bring ideas forward, and I think through your senior advisory councils, through individuals who actually are living and working, can bring those innovative ideas. And I think there is real opportunity to do that. And I think Tim Engelhardt at the Innovation Center is really willing. Do you agree with that? He's the head of the CMMI, and he is a good listener. He's really smart, and I think would really be wanting to listen to what you as at the ground roots level, and are more likely to hear, be receptive to that than to just have, some, big legislative, coalition come in and talk about it. So I don't know if others have comments or agree or.
Me, because I'm not bashful. Yep. Sorry, I'll hog the microphone. I had a little soapbox on this one, so sorry. People don't know who we're serving on Medicaid. There's a vast difference between who we're helping, the older people we're helping, and what the public thinks and what legislators think. So you have to start with that for most other populations, Medicaid is serving the poor, and there's stigma about poor people. So there's stigma. For older people on Medicaid, you do have people who are poor their whole life and now grow up, and they're old poor. But the need for long-term care itself will impoverish older people. And so many of the people that we're serving on Medicaid are the middle class. People who have worked their whole lives, have not been lazy, poor people, have worked people who, all these stigmas kind of get complicated here. People who've worked their whole lives, who have Social Security income, a retirement income, and they've got a $5,000 nursing home bill and $3,000 worth of income. And what people don't understand is for most older people, not all, but many, many older people on Medicaid, Medicaid is wraparound coverage, that the first dollars come from these people's hard-earned money for a lifetime. And so when I would testify about this in front of my legislature, I would start with, well, 18% of the cost of the care last year was paid by the older people themselves out of their pensions. So the public doesn't actually know who we serve. And so there is opportunity to distance themselves from the very people that are members of our families and our communities and ourselves in the future who will need the care. So I think we have a lot of public education to do about Medicaid and older people because it's completely misunderstood.
And also education around Medicare and what that is as well, because, you know, how many are on a government-funded program? Well, if you're on Medicare, you're on a government-funded program. And the stigma is less around Medicare, right, than it is around Medicaid. So that's a very good point. So thank you for bringing that up, because a lot of people do spend down. They spend everything they have, and now they're on Medicaid.
So I want to change gears a little bit, and I want to talk about, this came up a couple of times too, around retirement and sort of reimagining older age. You brought up the Frameworks Institute and reframing work that's happening internationally now. And Colorado's, the Rose Community Foundation here in Colorado has financed some awesome work happening across the state through Changing the Narrative campaign. So I'm curious, and I had a good conversation earlier today about retirement and the idea of retirement and old age kind of being flipped a little, and I think you brought that up in your session. So I'm curious what, maybe another question around the organic process of the boomer generation approaching older age and seeing it a little differently than prior generations. So that sort of natural cultural process of different perspectives, let's say, different behaviors, cultural orientations, and the institutions that were built and systems that have been built that are maybe very legacy at this point, that don't necessarily align with the culture of aging and the sort of emerging culture of aging that seems to be evolving. I don't know if that's too abstract of a question or too anthropological, but anyone have any thoughts on what that might look like or how that might be changing, and that sort of combination between the culture of aging and systems and policies that we're living with?
I'm going to take a quick stab at this in a very simpler and more direct way, and that is just to say, not to say that I don't. There's a lot of detail in your question that I'm not trying to avoid. I just when I was at Silver Sneakers, we had a lot of innovators come in and present privately to the leadership group, and one of the things that was a wow to me, that I would love to get the numbers, because I think Claire also mentioned it in her talk, is the extent to which a huge number of older adults are, they may be retired, but they are actively involved in the gig economy. And so Silver Sneakers is located in Arizona. Always I had to fly down there and then get a Lyft or Uber from the airport. Most of the people who drove me were older adults. And so I had awesome time to talk with people about older adult living, and I can tell you all of them had a reason for driving Lyft Some of them drove a fair amount of the time to stay alive, and some of them just a little bit so that they could take a trip with their grandchildren. But statistically, we were told by some expert that, in fact, a surprising number of retirees are actively involved in the gig economy. And beyond driving, Airbnb is a major revenue source for a lot of older adults. And so, yes, would they love to have a safe, long-term roommate? Possibly. However, Airbnb works, it's quick, and there are tons of folks using it. And so this is anecdotal, but I think that it's very clear that the gig economy is alive and well for those who can do it. And I think that there are a lot of people who would be interested in more interesting work, but those gig economy systems aren't necessarily set up yet. So I think that there's a lot of interesting opportunities and a lot of use going on right now. I don't know if that answered your question, but yeah.
I have some thoughts, but I'm trying to form them. So I think what comes to mind for me when I think about some of the conversation around gig economy and changing thoughts around how we interact with the workforce as workers in general.